I'm super excited. Aging is obviously a topic that all of us take very carefully. My wife always excuses me for loving to live in Japan because Japan is the one place where everybody else gets older faster than I do, which is always very nice to know. A very special shout out to Igarashi-san, who made this collaboration possible. And here at Asia Society, obviously, we do want to foster the collaboration, between Japan and the United States and other Asian countries. And aging is obviously a very, very important topic with all the advances and the challenges that come with it that are going on in healthcare policy. So I'm excited. And I think, Dr. Maus, I think we're going to start with you. Is that correct? Correct. And then we move right into the presentation by Kabayama sensei, and then we'll have a little fireside chat and Q&A, if that's okay. Without further ado, you've got the stage.
Thank you. Well, it's good morning, everybody, and it really is a pleasure to be here at the Asia Society, presenting alongside my colleague, Mike Kabayama, and I do want to thank the Asia Society, our organizers, and my colleagues, Professor Seng, also part of our collaboration. Today we will be discussing a little bit the global challenge, as was mentioned, of an aging society. And we're going to be highlighting research and collaborations between UC Berkeley and Osaka University. This picture that you see is one of the events that we held at Osaka University a couple years ago. And as was mentioned by Jesper, Japan is at the forefront of this demographic shift. But the US and many other nations are following very closely behind. So our goal is to explore innovative public health strategies and potential collaborations to improve healthy aging worldwide. The world is experiencing an unprecedented demographic shift. By 2050, the population aged 65 and older will more than double, leading to a profound social, economic, and healthcare challenge. Japan is the first country to face a super aging society, but the US, China, and much of Europe are moving in the same direction. So the key question is, how can we transform aging into an opportunity rather than a crisis? The demographic transition model, which you can see here in this slide, helps us understand how populations evolve over time. Countries start with a high birth rate and death rate, followed by rapid population growth as healthcare improves. Over time, birth rates decline, leading to population stabilization. Japan is already in what we call stage 5, with a birth rate lower than death rate, leading to an aging and shrinking population. The US is in stage 4, but it is rapidly transitioning towards stage 5. This shift has major economic and social implications, particularly for workforce, sustainability, healthcare, and pensions. Today in Japan, 1 in 4 people is over 65, and by 2030, that number will rise to 1 in 3. This is driven by longer life expectancy and declining birth rates, which is leading to labor shortages, increased healthcare demands, and financial strain on social security systems. Japan's response to these challenges can provide valuable lessons to other nations, including the US. As populations age, the balance between younger working age individuals and elder retired individuals shifts. In 2020, the global older age dependency ratio, ODR, was 17, which means that about 6 working age adults supported each older person. By 2050, this ratio will drop to 3. Japan's ODR in 2050 is projected to be 89, which means that fewer than 1 working age adult will be working for each older person. And this is a great challenge for economic stability, pensions, and the healthcare systems. So while Japan is already facing a super aging society, the United States is following very closely behind. By 2034, for the first time in US history, there will be more people aged 65 and older than children under 18. This shift presents an opportunity to learn from Japan's experience and apply proactive policies in healthcare and planning and social security reform. So, as we discussed aging in different populations, it is important to define what do we mean by healthy aging. The CDC's Healthy Aging Research Network defined it as the ability to maintain optimal physical, mental, and social well-being throughout older adulthood. The WHO defines it as maintaining functional ability for well-being in older age. Achieving this is not just about medical care. I'm a physician and I can tell you that what this requires is the upstream public health approach of prevention. It depends on safe environments, strong social networks, and accessible community resources that can support aging populations. It means building capacity starting early in life through good nutrition, physical activity, and education. This approach aligns very well with Japan's commitment to fostering livable, age-friendly communities, and it makes it a strong area for international collaborations. To better understand the factors that influence healthy aging, we use what is called the ecological model, which you can see on the right. This model highlights how aging is not just about individual choices. It is shaped by families, by institutions, communities, and policies. For example, a supportive family network, which is the interpersonal level on the slide, can help an older adult remain independent. At the community level, age-friendly housing and walkable neighborhoods can make a significant difference. At the policy level, healthcare access, social protections will actually shape the long-term aging outcomes. This is a multi-level approach which is relevant both to the United States and Japan as we try to design interventions that promote equitable, inclusive aging experiences. As populations age, the focus of public health must be to shift from simply increasing lifespan to ensuring a longer health span, helping people live not just longer, but healthier, more fulfilling lives. Aging is not a biological process only. It's deeply influenced by the social determinants of health, which include income, education, healthcare access, and social support systems. Japan's experience has taught us a lot about aging. While its super aging society presents challenges, it also shows how policies can support older adults in remaining active, independent, and engaged. But most importantly, we must reframe how we think about aging. Older adults are not a burden, but rather an untapped resource with wisdom, skills, and potential contributions to society. Aging, as we mentioned, is a shared global challenge, and no single country has all the answers. By collaborating internationally, we can share knowledge, policies, intervention strategies, and we can learn what works and what doesn't from each other's experiences. For example, Japan has pioneered aging workforce policies and healthcare sustainability. Meanwhile, other nations are developing community-driven models to support healthy aging and social engagement. So cross-national research is essential for evidence-based, scalable solutions. And maybe many of our aging-related challenges, such as chronic diseases, social isolation, and healthcare strain, are universal. So working together allows us to design stronger policies that better serve aging populations. This is why international research collaborations like the partnership between UC Berkeley and Osaka University are so important. So by leveraging each other's strengths, we can build a more effective, adaptable intervention for healthy aging. Let me talk a little bit about Berkeley's Health Research for Action. This is a group that was co-founded by the late Dr. Leonard Syme, a pioneer in social epidemiology, and Dr. Linda Newhouser, who's a multidisciplinary researcher dedicated to health equity. He recognized that research alone was not enough. So they created HRA over 25 years ago to turn academic knowledge into real-world solutions that improve lives. And since then, we have been working in diverse communities across the globe, factories in China, villages in Vietnam, youth centers in California, and public health departments across the US. We specialize in what is called participatory design, ensures that health information and interventions are accessible, actionable, and impactful. Many traditional public health interventions fail because they are top-down approach, assuming that what communities need is what we want to give them, rather than engaging them in the process. So this often leads to interventions that are not culturally relevant, practical, or sustainable. So a more sustainable, a more effective approach is what we call participatory design, where we co-create interventions with the communities. This method ensures that the solutions are meaningful and accessible, and they are tailored to real-world needs. One key framework within participatory design, and many of you in the audience have probably heard of it, is design thinking, which was originally developed in the 1970s to solve complex engineering problems. It has since expanded into fields like computer science, architecture, and policy. In public health, we use design thinking to reframe challenges and prototype solutions. And it is essential for tackling complex issues like aging. So by embedding participatory design in our research, HRA and Osaka University are fostering collaborative, innovative approaches to healthy aging. As societies are aging, we face three major challenges: physical inactivity, cognitive decline, and social isolation. There are countless studies now that show that even moderate exercise decreases all-cause mortality and cognitive decline, as we can see in the graphs on the right. These issues contribute to increased dependence, higher healthcare costs, and lower quality of life. So let's look very quickly at one example of research that we have done to address all of these issues. If you look at traditional exercise programs, they often struggle to maintain long-term engagement, especially among older adults. They lack social motivation, they fail to account for mobility challenges, and they do not offer cognitive stimulation. So what we wanted to do was to look at a technology-based intervention. So we developed a program called WordWalk, which is a mobile exergame designed to integrate walking with cognitive challenges and social interaction. So we tested this for 12 weeks in the North Berkeley Senior Center, and we had some very promising results. There are two phases to the WordWalk app. First, the participants follow a mapped route on the mobile device in small groups, 3 to 5 people. And while they walk, they reach certain points and they collect letters in each one of these points. The routes can be customized based on distance, terrain, mobility levels, and which makes it much more accessible to a wide range of adults. After they finish, the participants sit down and they use their collected letters to form words in a Scrabble-like game. And this encourages problem solving and cognitive engagement. They work in teams, so they are actually competing against each other to get as many points as possible creating the words. And believe me, it was incredible to see how seriously they competed for the winning title. They not only stay active, but they also form social connections. And many of the participants actually formed lasting friendships after the intervention was over. It also made exercise more enjoyable and sustainable. And these are some of our participants who won at the end of the event. So Japan is at the forefront of global aging and has shown it is an ideal place to implement innovative solutions for healthy aging. With its advanced mobile technology and strong public health initiatives, Japan is very well positioned to adapt and scale a program like WordWalk. More importantly, WordWalk aligns well with Japan's broader efforts to create sustainable aging solutions. And we are very eager to explore partnerships with academia, healthcare professionals, government agencies, and tech industry entrepreneurs to bring this concept to a broader audience and hopefully improve aging outcomes through digital innovation. Another project, the Hmong, a Southeast Asian ethnic group resettled in the U.S. as refugees after the Vietnam War. Many older Hmong adults experienced severe psychological distress due to war trauma, language barriers, and cultural displacement. Traditional Western mental health models most often fail to meet their needs. So, as stigma and distrust prevent many of them from seeking services. The Zuziab program, developed by the Hmong Cultural Center in Butte County, bridges this gap by integrating culturally rooted traditions and community-led mental health support. This participatory approach aligns very well with HRA's model, and it engages the communities as co-designers in health interventions. The program has successfully reduced psychological distress, strengthened social networks, and improved well-being. The Zuziab program centers on culturally meaningful social activities for Hmong elders. It integrates peer support, mental health education, and socialization through weekly gatherings and cultural retreats that reconnect participants with traditional healing practices. A key feature is the community garden, which fosters social engagement, therapeutic gardening, and intergenerational knowledge sharing. This includes things like cultural herbs, recipes, and healing practices. So by blending Western medical health education with traditional Hmong approaches, this program provides an integrative, culturally rooted model that enhances mental well-being. Long-term data shows reduced psychological distress, increased mental health service use, and a stronger cultural and social connection among the participants. So while this program was developed for the Hmong elders in the US, it's a model that is globally relevant. Japan, with one of the fastest aging populations, faces increasing mental health challenges, particularly among vulnerable and rural adults. There are various models that have been developed in Osaka University and Berkeley, such as participatory model, the Zuziab, which we used in the Zuziab program, which is a community co-design intervention. But there are also other models being used in Osaka, such as the one used in the Sonic and the Noze studies. Professor Kabayama will talk a little bit more about those. Other possible areas of collaboration include integrating traditional Japanese healing practices into mental health services, using AI-based tools for community engagement, and by partnering with Japanese researchers, mental health professionals, and policymakers, we can build this community-defined evidence model to improve mental health outcomes in both countries. One of the key findings from our research is that different cultures define aging well in different ways. As part of the CDC Healthy Brain Project, we conducted focus groups, and we found that in diverse populations in the US, Chinese older adults, for example, saw a strong connection between mental well-being and physical health. Vietnamese elders valued mobility and family interdependence over independent living. Latino participants focused on mental outlook rather than longevity. And American Indian, white, and African Americans emphasize social engagement as a key factor for aging well. So this underscores the need for culturally tailored aging interventions, a principle that can also be applied in Japan, where aging expectations and traditions differ from Western models. The CDC Healthy Aging Network, HAN, was a very successful collaboration effort focused on aging and public health. It brought together leading academic institutions and local communities to identify key factors in healthy aging and to develop evidence-based interventions and to inform national policy. This program, unfortunately, was discontinued in 2014, not due to the lack of success, but as we know, due to political funding priorities shifting at that time. But the work that Han did remains very relevant today. So, as we have seen, aging is a shared global challenge. The CDC Han model can provide a framework for building a new Trans-Pacific Aging Research Network that can connect experts across Japan, the US, and possibly Trans-Pacific nations. This network could facilitate comparative research, policy exchange, and development of community-based models, which would ensure that the solutions are culturally adaptable and evidence-based. It could help secure joint funding, expanding faculty and student exchanges, and strengthening partnerships between leading research centers like Osaka University, UC Berkeley, UCSF, and many others. So, as we conclude, we want to emphasize that collaboration should extend beyond just research networks. We want to create meaningful, multi-level interventions. We envision long-term partnership between Japan, the US, and possibly other trans-Pacific nations, not only in research, but in policy development, funding, and real-world implementation. So as I was preparing for this lecture, I realized that a great example of this is Asia Society Global Cities Education Network, which connects cities across Asia and North America to exchange best practices in education. So maybe we could conceive a similar aging and public health collaboration network, which can bring together research institutions, but also policymakers, community leaders to drive innovation in healthy policy and practice. So additionally, we could hold regular symposiums and workshops on public health and aging, which would allow experts to collaborate on solutions that are practical, scalable across diverse cultural and policy contexts. So by integrating research, policy, and practice, we could build a sustainable, evidence-based global aging ecosystem that improves health outcomes worldwide. So with that, thank you very much, and I will now hand it over to my colleague, Dr.
Okay, thank you, Marlon, and thank you very much for giving me this very wonderful opportunity to present. And I'd like to express my sincere gratitude to Asian Society and everyone involved for giving us this wonderful opportunity. So I'm going to talk about the promotion of integrated implementation of health services and long-term care prevention for the older people in the community in Japan. So my name is Kabayama, and I used to work as a public health nurse in Osaka, and now working at Osaka University as a professor in the area of health promotion. And my research topics are the prevention of loss of independence and healthy aging lifestyle modification intervention. As Professor Marlon mentioned earlier, Japan has rapidly aging its population, like here, and especially in Asia, because it's had a lower aging rate. It's indicating that it's aging even more rapidly than Japan. But still now, Japan is a front runner of aging. So, can you see what is this graph? You know, anyone can guess? Red is woman, blue is man. Anyone? No.
Healthy attitude towards old age.
Very close.
Women outperform.
Actually, this is the number of centenarians.
Minutes of life after 65.
Yeah, it's very close. So this is the number of centenarians. So you can see 30 years ago, it was very small number. And since then, it has been increasing rapidly. And the majority of them are women. Very strong, women, very strong. And these twin centenarians, Kin-san, Gin-san, maybe many Japanese remember of them. They're from Nagoya, so very close, originally from my place. And the kin means gold and gin means silver. So gold and silver twins were both in very good health and were very popular at that time because the centenarians are very rare at the time. So these pictures are of centenarians who are participating in our study. Their health status and level of independence varied greatly. The degree of independence is very different. So let's look at this graph. It's familiar with you. Older population rapidly growing. Then let's take a look at this graph a little differently. Now we have grouped them. So over 75 years and also 65 to 54. So we can see the challenge is that Japan has a number of very old population aged 75 years or older is increasing. So extended survival is very in old population is not always accompanied by good health. It has been inevitably associated with greater number of disabled who need additional support in daily life. So here we can see the turning point. So now more than 75 years is more than 65 until 74. The characteristics of the older person vary greatly depending on their age. The 65 to 74 age group is very active, and the cause of death are cancer or cardiovascular diseases. Over 75 years of age, causes of death also increase with pneumonia or disability or frailty due to old age. So based on this background, the total cost of long-term care and also the medical expenditure has been increasing. This is a graph showing average life expectancy, the green bar, and health life expectancy, the blue bar. The definition of healthy life expectancy in Japan is a period of time during which a person can live independently without requiring nursing care. Since both are increasing, there is a gap about 10 years for both, for men and women. And we can see women is a bit longer. Extending the healthy life expectancy is important. for not only for the quality of life of individual, but also for the sustainability of future medical and social security in Japan too. So based on this background, Japanese Ministry of Health, Labor and Welfare started to emphasize on preventive intervention, as Marlon said. So what we, as a health professionals, are working in the community in this group. So we're doing individual approach to like nutrition and physical function, etc. And with it, this green enrich the social environment to prolong healthy life expectancy. Here are the major diseases that cause the need for long-term care. Number one, you can see, is dementia. And number two is stroke. And following frailty, fall, fracture, and joint diseases. So the hypertension is a major factor behind these dementia and stroke, which is the most frequent lifestyle-related diseases among Japanese people. And these three are called geriatric syndrome due to the effect of aging. So these are the two big main reasons for the long-term care. So here is an explanation about the frailty. Have you ever heard of the word frailty? Mm-hmm. Maybe many, oh yes. So frailty is an intermediate state between robust and disability in other adults. Frail older adults are at high risk of adverse clinical outcomes, such as falls, hospitalization, and become disability. The important point is that it is possible to return to robust if appropriate measures are taken during this frailty stage. So from here, I'd like to introduce our research activities and findings that we are working on together with local governments. This is an overview of the town of Nose, not Nose, Nose. So they are our collaborators. Nose town is located in the northern part of Osaka Prefecture, and 80% of the town is covered with forests. The population is approximately 9,500, is on a declining trend, and the aging ratio is extremely high at 42. So it is the desire of the residents to continue to live their hometown, and it is also important for the administration of the town, which is facing a shrinking population. So in order to realize this, it is important for people to be healthy and independent. Therefore, the Town Health Division has launched the Healthy Longevity Project, which promotes two major pillars. So one is the prevention of dementia and stroke, which is the main cause for NOSE 2, the cause of the need for nursing care. And the other one is prevention of geriatric syndrome. So for the dementia and stroke, the strategy is to promote people to measure their blood pressure every morning and every evening at home. Many Japanese have the blood pressure monitoring, but they do not do that. So we promote them to measure that. So this is being done in collaboration with Omron Healthcare, a company, and currently about 18% of the town residents are participating in this project. And we researchers are investigating the effectiveness of the program. So programs were performed in a community intervention design. The participants were divided into two areas. Region A, the early intervention area, and they started the daily home blood pressure measurement from 2020. And region B, the control group, where residents start to daily measurement 2 years later from 2022. And the results shows that in a group of women with slightly declined cognitive group, we can see the significantly higher cognitive scores we can observe 2 years later in the measurement area. So we believe this is due to the effect of self-monitoring of their own health condition every day. And this is the one in prevention of geriatric syndrome. So older people are doing exercise, you can see, so following the video, which local government made and public health nurse made and distributed for every community. So they have about 50 places all around the town. So they gather with neighbors. It's a walking distance. So they gather with neighbors every once a week in the community hall. And so they exercise with weight on their wrist and ankle to keep their muscle. So we can see the result. So by comparing the physical function data at baseline attendance, and 1 year later, all items showed significant increase in function. For example, walking speed and standing up and down became faster, and grip strength became significantly stronger. So here's a change in subjective health of the participants. The subjective health, how do you feel your health, is reflecting overall health status and have been reported to be associated with mortality or other conditions. So there are an answer, and we can see an increase in the percentage of those who responded very good or good over 6 months period. Thus, significant physical improvement could be seen as a result of the community-gathered exercises. So now, frailty is not only a physical condition, but also consists of social factors such as isolation and psychological aspects such as depressed. Therefore, it is also important to assess a person comprehensively to find their intrinsic capacity and ability. So during COVID-19 pandemic, many older people refrained from going out of the house, which led them frailty, including cognitive function. In a study we conducted, 21% of 80s experienced cognitive decline due to the pandemic social situation. Previous studies have reported that social isolation also accelerates frail and cognitive decline. So at this time, the use of ICT was the main strategy in the world. So therefore, we analyzed how the use of ICT affected in those relationships among older people. Interestingly, the result shows that the risk of cognitive decline was significantly increased in people over 80 years when they were isolated and don't use ICT, but was suppressed when they were using ICT, even in high isolation. And here are the results of an epidemiological study of the very older people, septuagenarian, octogenarian, and nonagenarians. In left graph, the functional abilities variables like SPPB, these are physical performance, and albumin, the blood nutrition indicator, and MOCA, the cognitive function scores. All of these variables are declining along with the age. Aging is strongly affecting these functions. So, what about the psychological variables? In fact, the only thing that declined with age was negative well-being, while surprisingly, positive well-being increased. So finally, here's a photo of recreated meal of an independent centenarian. To our surprise, they were eating the same food as we do. More good than me. In addition, many of them drank coffee and ate sweets every day. When I talk about this, many people ask me, how about alcohol, sake? And this suggests that it is important to maintain the ability to chew and swallow. And to do so, it is essential to maintain oral function. So, talk, laugh, and chew well is very important. Currently, comprehensive support for the older people is being promoted in the community by preventing the aggravation of disease and frail prevention in Japan. Health professionals are working to identify and approach those who are at high risk of malnutrition and frail, as well as a population approach. So they are outreaching to community gathering. So this is an example of the malnutrition high-risk approach in Suita City, Osaka, where we are doing research. In this program, a dietitian provides individual counseling 3 times to those who were identified to be at high risk of low nutrition by the questionnaire. And it reported that many of them shown results of improved nutrition status. And this is a picture of a population approach. A dental hygienist and public health nurse going to a community gathering to provide health education and explain about exercise to maintain oral function. And this is a leaflet intended to be continue exercise at home every day. I recommend most of you to do at home every day. Many people are unaware of this exercise, but in fact, we find many people with oral frailty. So it is important to spread the knowledge of this concept, like oral frailty or frailty itself. Thus, prevention of long-term care needs is very important for healthy aging, and community development is also required as a foundation to effectively promote these projects. We have been working with UC Berkeley professors on the above research initiatives, incorporating a variety of perspectives. So last month, together with UC Berkeley professors, an interdisciplinary team from Faculty of Dentistry and orthopedics and the mayor and administrative staff of Town discussed for the future strategy. So until now, we have been collaborating on many research projects and aiming to solve social issues from different perspectives. And our students have been greatly stimulated, and this has led to a global education too. So this is the official character of Town. And they are also measuring blood pressure. Thank you very much for listening.
Wow, wonderful. Thank you very much for this overview. I think there's a lot of food for thought here. And maybe at the outset, let me sort of ask one sort of bigger picture question. It seems that Japan is obviously at the forefront, and there's a lot of studies going on, and they're very holistic in the sense that it's not just the pharmacological intervention, but it is the focus on the community, it is the focus on the family, et cetera, et cetera. Dr. Maus, how is this received in the United States of America, where, I mean, as a complete amateur observer, it seems that the focus is all on pharmacological intervention rather than sort of community building. Just tell us a little bit about, how your research is being perceived amongst public health officials and community leaders, in the United States.
Thank you. One of the big differences between Japan and the US is that in Japan, a lot of what we're talking about is much more centralized. So in Japan and in other countries with similar approaches, you are able to provide basic things like universal health care and long-term care insurance. The US, as you know, is extremely fragmented, and most of the care is Medicare and Medicaid for the elderly, which unfortunately leads to the fact that you have many players, such as the pharmaceutical company, with much greater power. Right. And that is something that is going to require changes in both policy and cultural acceptance. In Japan and in Europe, a centralized approach is much more acceptable than in the US. So that, I believe, is one of the big differences.
Right. Kabayama Sensei, if I may turn to you, sort of, when you're obviously, very involved, sort of in the Japanese projects, in the Japanese communities, also with your background as a practitioner, when you started the collaboration with Berkeley, with the Americans, what were the sort of 2 or 3 things that surprised you the most about the American way of approaching things and the American way of doing things?
The most surprising thing is that really community-driven.
Very community-driven.
Yes,
right?
and in Japan we collaborate, and then we can do the research and the projects. Right. But it's really for public health nurses, they feel it's really restricted, right. And they cannot, like, for the blood pressure monitoring, they can't give to them. The Omron gave us, but because for the, for the equity, in Japan we should be equity because they are working by taxes, so they can they have to equally provide services.
Right.
And residents, they feel the government can make the strategy and it's like they are following. But in US, they are like, they, they tell them, not tell them how to say, but they make that strategy, but the community itself, they work and they speak up.
Right, right.
And it's really nice to that because that is their problem, and they themselves solve that.
Okay, so it's more bottom up in America, and it's more top down in Japan.
Yes.
With this emphasis on, everybody it needs to be for everybody in an equitable and equal state.
Yeah, right. Exactly.
Right, very good. I want to open it up, for questions from the audience. Any, please, and if you very, very quickly state your name, who you
Hi,
are.
I'm Chie from Haas 98.
Okay,
Go Bears. Go Bears.
fantastic.
Yes. Thank you. It's very interesting. And your presentation reminds me of like Netflix Blue Zone. Have you guys seen this? Netflix
Blue Zone.
Blue Zone. Yes, yes, it's a huge thing in the States. And my company offers authentic experience travel to luxury travelers, you guys. And I got lots of inquiries regarding ikigai or mindfulness. And many people now looking for coming to Japan to search kind of like ikigai or like a more mindful things. That's a kind of new trend. And I feel like it's very interesting. So I feel like Japan can do a lot to work on that kind of global aging issue in terms of like those our ikigai or like a mindfulness approach. And that's why I find it very interesting to hear what you're saying. But what do you think about that kind of a Japanese way of mindfulness ikigai approach to work on these issues?
どうぞ。
Thank you. I think that is really important point, and I just did the research about ikigai, what kind of ikigai they have, and the top one for the older people is having good meal, and the second one is like traveling and enjoying. And very interesting is for the having good meal is significantly greater for women rather than men. And also the traveling and enjoying hobby is also enjoying the rather than men, women were more higher percentage. And when we see about the communication with family, both men and women, they have the feel that ikigai. But when we see communication with partners, only men have a lot feel that ikigai. And I don't know why.
Seriously, you never knew Japanese men actually talk to their wives. Amazing.
But that was an interesting point that there's a sex difference, but they are having ikigai. So ikigai, you can have any age, and when we see that age difference, it was the same as a positive well-being. It stayed. It didn't get down. So people can enjoy if they are not in good health or if they are in the long-term care needs, they also can have ikigai. So it's really important. And if they have ikigai, maybe it can prevent frailty, but also they can enjoy their life even if they're frail or not in good health.
Dr. Maus, from your perspective, the Japanese concept ikigai, and I mean, what was your reaction as an American hard-nosed scientist practitioner? Mike.
You know, America is discovering many of these Asian long-term traditional approaches to life, and unfortunately, Americans tend to adapt them to the American way, which is they will take something like yoga. You know, the concept of yoga, which in India, it's an integral, holistic system similar to many in Japan, and they take just the parts that are interesting to them. So the meditation part, the philosophical part sort of gets pushed to the side, and they do the physical part. Let's do yoga, hot yoga. even better. So I think that there is a need, and I think there is a recognition that it makes ultimately things like this, just like community living, make a huge difference in longevity. But America needs to learn that it's not just the physical parts or the easy parts. Another example is America likes easy things, pills. So if you have a pill that you can take instead of exercise, they will take that.
And you yourself, you red or blue? Which one? Or green? Or
Right, exactly, or both.
Or both.
Combine them even better. So I think it's a cultural difference, as we know. But one of the things that comes out of these collaborations is being able to apply some of the findings that what Mai was just mentioning to our research and see how that can be applied in the U.S. So thank you for that question, but I think it's ultimately very important.
What is actually quite stunning is that, I mean, here you have in Japan a society that is ruthlessly brutal in terms of the salaryman, everyday work lifestyle. And that, there's lots of karoshi, death by overwork, but as particularly the bulk, the baby boom generation, which was brutal in terms of, the workload that they took on and the sacrifices that they made for community, for family, for working for the company, that this generation is actually the one that is discovering and living ikigai, that is actually the one that keeps on pushing, right, the longevity boundaries, both in terms of healthy and effective aging, as well as, the overall aging structure. So it's quite interesting, that both sort of coexist. Lauren, I think you had a question.
Lauren Kawasaki. I'm just very interested in longevity, so I have some questions. So I've been a long-term resident of Japan, so I've had lots of experiences here. I think Japan does an amazing job with preventive care, with the Ningen doc system. It's very fractured, but it provides services. It does that really well, especially if you're a salary person up to a certain age. And then for personal experience, Kaigo kind of kicks in, the long-term care kicks in when you actually have something wrong. So whether you're stage 1 to 5. I feel there's a gap between 63 and 65 to the 75, 80, where you have serious health issues. How can the country save money in the long term by adapting technologies to stay connected and motivated between the 65 to the 80-year period? Because when an employee leaves their company at 63, they go down with depression, lack of social involvement, their health isn't monitored as frequently. I think the Omron example is perfect, but it was only 18% of the participants. Should the government, is the question, should the government provide funding for technical intervention, monitoring, participation, whatever, in order to reduce the long-term cares potentially in the future? And is there a movement for the government to invest in that area, or are we only focused on taking care of the people lying down in the beds?
Yes, that is really important point because, as you said, that after 65 and retirement, and then they get socially and physically declines. So we have to continuously we have the continuous support is very important, but the system is divided. And when you get 74, the health service become for the late older person's insurance, everyone. So that now it's the role of insurers, public insurers, becoming very strengthened, and they provide services like you said, Ningen Dog or preventive approach is strengthening. So we have to provide the services like for the people in earlier stage to prevent like metabolic syndromes, but also have to continuous services like for older age, we have to change the intervention from metabolic syndrome to take more nutrition. So but there's a gap that to the providers are different. So there must be some need to connect, and that technology can maybe solve that problem. But I don't have the answer for that. How the technology can solve? Maybe some using ICT usage is very effective for younger generation, and also we can see older generation, but maybe not only from the government but also they choose and like, it's it's like the American style that person driven, and
So-
they choose and they pay to buy the some like technology and continue so that they can continue.
It is interesting, Lauren, because you're absolutely right in terms of the central system sort of creates this gap. But what happens at many of the community levels, if you speak and engage with the mayors or even the local governors in the different provinces, they're very, very aware because the claims for that from the baby boom generation, which is in this gray zone, are actually growing. And at the local level, at the community level, as was pointed out here, there's more of a groundswell to actually enact that. So that's where there's sort of a gap between the very well-functioning central system and actually the community-based system, right? And it's a development, right? Robbie.
Thanks. I'm Robert Feldman from Morgan Stanley. I have two questions. I just finished reading a wonderful book called The Worlds I See by Dr. Fei Li. She's an AI professor at Stanford. And she spent 12, 15 years now in a healthcare initiative that she started with people in the Berkeley area, walking around hospitals, watching what people do day to day to see if we can improve the impact of AI methodologies in healthcare. So I want to ask both of you, in terms of further application of AI, sort of human-centric AI, where are the barriers? Is it data? Is it software? Is it hardware? What are the things that would push AI forward to being more productive? And secondly, I'd just like to ask you where you think nutrition is as an element of improving both cognitive and physical performance. Because I've done a little work on this, and it strikes me that if we're going to live to 120, we can't retire at 65 anymore. So we better be able to work till we're 95. What is the contribution of nutrition, and how do we make that happen? So two questions, if I may.
If I may, actually, your first question is related a little bit to the other one, which is the use of technology. And one of the differences, it seems to me, between the Japanese approach and the American approach to the use of technology in healthcare in general, but in aging in particular, is that, as you have mentioned, in here, it's very top-down. America spends more per capita in healthcare, as we know, than any country, vastly more, with much lower results in many areas. But there is a positive point to this, which is that because the costs, it often are related to insurance companies and to private entities rather than the government. I mean, we know the big government programs, which are, like in Japan, are at risk of having problems down the road very quickly. But that means that companies and health systems are much more able to use technology and adapt it faster if they can see profits in it, or cost-cutting measures. So going back to AI and to some of the technologies that you alluded to, is the fact that there are areas that AI will work probably to decrease cost and increase productivity. And some of those are the care of older adults, to try to keep them at home. The U.S. tends to have longer care more institutionalized rather than at home, but there is a big move in public health to try to keep older adults at home, like in Japan. And that's where technology may make a difference. So you have things like AI and other technologies, assistive technologies, which can help caregivers. So that's one area that is really growing very fast. Another area is to use technology to keep older adults healthy, like the Word Walk program and some of the programs that Mai mentioned. What are some of the barriers? Some of the barriers that you were asking about are, of course, older adults may not be as tech savvy. So there's always that barrier, digital knowledge, just the approach to digital. Cultural differences. Some people prefer human beings. So, they're not going to be easily accept robots or technology-driven, or even the use of smartphones, etc. And then there's, of course, concerns for security, which is, putting that much medical and personal information in technology is always a concern. So that's some of the issues, I think, that we can look at. And just very quickly, in terms of nutrition, it's multifactorial. I think you're absolutely right. Keeping people in the workforce longer is not only a necessity because of the numbers of support that we mentioned before, but also it's been found that for health, people who are able to adapt to longer term, to stay involved in work or in something that they're interested in, ultimately decreases depression, decreases morbidities, etc. So, and nutrition is, it's a stool, several legs, and without nutrition, you fall. But on the other hand, without preventive care, you also fall. So, without exercise. So, I think it's multifactorial, and that's an essential one. So, we have to look at all of them. I don't know if you have anything to add.
And the nutrition thing is the same as Marlon, and about the AI, and I'm thinking that not in the prevention area, the AI can do a lot of things. Like if you know you are very high risk of like falling down, your working style is very high risk for like or cognitive failure, or then you can be careful and protect that. And for the hormones, like everyday blood pressure, we can maybe AI can detect the future risk, big risk for because they have the everyday monitoring. So so we can use that for the prevention. But on the other hand, like Marlon said, people want to meet doctors and talk with them. So not only from AI, but also maybe we need to communicate with health professionals to behavior change. When even AI exists, maybe people cannot change. So the both can make the AI technology very effective?
Yes, we have a lot of questions from the online audience, but unfortunately, we probably only have time for a few. This is a question from Hiroshi Saito. Japan is a super aging society, and on one spectrum, we have an aging population, but on the other, we have a very low birth rate. Can the panel comment on how, comment on the latter, the birth rate? For example, how to improve the low birth rate, what kind of lessons we can draw from, the aging and community work. Is there anything that you can comment on the birth rate of Japan?
So many things to solve, but for the one thing that about related to the older population, maybe they can get together the generation communication could be the one to solve that.
I would like to take a step back for a second and look really globally at the number of people in the world. Trying to increase birth rate, it sounds like it's a solution, but if that happens everywhere and every country tries to solve it by increasing numbers, there is a limit. We know that, and global warming, etc. I mean, we all know that in this audience. So perhaps we can look again, pull back and look again at what an older generation can do to sustain. What we're talking about is maintaining the country and productivity. So how can an older generation, an aging generation, help with that? And then I must bring up a topic that is culturally a little bit difficult in here, which is migration. And Japan has been very careful over many decades regarding immigration, but I think there's examples now that it's becoming more acceptable. Like, for example, in long-term care for older adults, there seems to be more of an acceptance of migrants with special permits and special visas, etc. And if you look around the world, Nordic countries in Europe and other countries have become more open to migration as one approach. Very delicate subject, but maybe we have to look at populations a little bit differently in terms of the world.
I mean, the topic of aging, obviously, there are many different facets that come through it. One of the things is the way the political environment changes. I mean, in Japan, you basically have now almost 70% of all the people who vote are the people who are over 65. In my home country, we just had an election. There was about 2 million new people who'd never voted before who voted. Overwhelmingly, the young ones voted for the extremes, for either the extreme left or the extreme right. So there are many different issues. Yes, fertility is obviously one of them. Aging happily, is obviously one of them. So our societies face some very interesting dynamics and challenges that are very, very multidimensional. And I applaud, the collaboration between, Berkeley and University of Osaka. I think that we all agree that Japan is a laboratory because it is ahead of the curve, with aging. Japan also is an exception because the coherence and the strengths of society and of community and ultimately of family is very, very strong. It's a high-trust society, while many of the societies that are going through this aging process, unfortunately, are no longer high-trust societies, the fragmentation that the professor alluded to. So there are differences, but there is a lot that Japan can give. And again, I want to applaud you for your work. Anything that we can do to promote, further research, to promote further awareness, and to highlight some of the positive examples, that Japan can actually bring. Please, engage with the Asia Society, particularly the Asia Society here in Tokyo and in Osaka, right? The new rep office. No, yeah. And want to thank you for coming out.